Sphenoid Bone, Part 1. Introduction. The sphenoid bone is situated at the base of the skull, in front of the temporals, and basilar part of the occipital. It somewhat resembles a bat with its wings extended. It is divided into a median portion or body, two greater wings and two lesser wings extending outward from the sides of the body, and two pterygoid processes which project from it below. The body, more or less cubical in shape, is hollowed out in its interior to form two large cavities, the sphenoidal air sinuses, which are separated from each other by a septum. The sphenoid articulates with 12 bones, 4 single, the frontal, ethmoid, vomer, and occipital, and 4 paired, the palatine, parietal, temporal, and zygomatic. Body, superior surface, Part 1. The superior surface of the body presents in front a prominent spine, the ethmoidal spine, for articulation with the cribriform plate of the ethmoid. Behind this spine is a smooth surface, slightly raised in the middle line, known as jugum sphenoidal. The superior surface is bounded behind by a ridge, which forms the anterior border of a narrow transverse groove, the chiasmatic groove or optic groove, above and behind which lies the optic chiasma. The groove ends on either side in the optic foramen, which transmits the optic nerve and ophthalmic artery into the orbital cavity. Body, superior surface, Part 2. Behind the chiasmatic groove is an elevation, the tuberculum sellae. Behind the tuberculum sellae lies a deep depression, the sella turcica, the deepest part of which lodges the hypophysis cerebri. The anterior boundary of the sella turcica is completed by 2 small eminences, one on either side, called the middle clinoid processes. The posterior boundary is formed by a square-shaped plate of bone, the dorsum sellae, ending at its superior angles in 2 tubercles, the posterior clinoid processes. On either side of the dorsum sellae is a notch for the passage of the abducent nerve. Below this notch is a sharp process, the petrosal process, which articulates with the apex of the petrous portion of the temporal bone and forms the medial boundary of the foramen lacerum. Behind the dorsum sellae is a shallow depression, the clivus, which slopes obliquely backward and is continuous with the groove on the basilar portion of the occipital bone. It supports the upper part of the pons. Body, lateral and posterior surfaces. The lateral surfaces of the body are united with the greater wings and the medial pterygoid plates. Above the attachment of each greater wing is a broad and curved groove, named the carotid groove, which lodges the internal carotid artery and the cavernous sinus. Along the posterior part of the lateral margin of this groove, in the angle between the body and greater wing, is a ridge of bone, called the lingula. The posterior surface is quadrilateral in form and articulates with the basilar part of the occipital bone. Body, anterior and inferior surfaces. The anterior surface of the body presents in the middle line a vertical crest, the sphenoidal crest, which articulates with the perpendicular plate of the ethmoid and forms part of the septum of the nose. On either side of the crest is an irregular opening, leading into the corresponding sphenoidal air sinus. These sinuses are separated from one another by a bony septum. They are partially closed in front and below by 2 thin curved plates of bone, the sphenoidal conchae. The inferior surface presents in the middle line a triangular spine, the sphenoidal rostrum, which is continuous with the sphenoidal crest on the anterior surface and is received in a deep fissure between the alae of the vomer. On either side of the rostrum is a projecting lamina, the vaginal process, directed medialward from the base of the medial pterygoid plate. Pterygoid Processes, Part 1. The pterygoid processes, one on either side, descend perpendicularly from the regions where the body and greater wings unite. Each process consists of a medial and a lateral plate, the upper parts of which are fused anteriorly. A vertical sulcus, the pterygopalatine groove, descends on the front of the line of fusion. The plates are separated below by an angular cleft, the pterygoid fissure, the margins of which are rough for articulation with the pyramidal process of the palatine bone. The anterior surface of the pterygoid process is broad and triangular near its root, where it forms the posterior wall of the pterygopalatine fossa and presents the anterior orifice of the pterygoid canal. Pterygoid Processes, Part 2. The medial pterygoid plate is narrower and longer than the lateral. It curves lateralward at its lower extremity into a hook-like process, the pterygoid hamulus. The medial surface of medial pterygoid plate constitutes the lateral boundary of the choana, or posterior aperture of the corresponding nasal cavity. Superiorly, the medial plate is prolonged onto the undersurface of the body as a thin lamina, named the vaginal process, which articulates in front with the sphenoidal process of the palatine, and behind this with the ala of the vomer. The anterior margin of medial pterygoid plate articulates with the posterior border of the vertical part of the palatine bone. The lateral surface of lateral pterygoid forms part of the medial wall of the infratemporal fossa. Pterygoid Processes, Part 3. The two plates diverge behind and enclose between them a V-shaped fossa, the pterygoid fossa. Above this fossa is a small, oval, shallow depression, the scaphoid fossa. The angular prominence between the posterior margin of the vaginal process and the medial border of the scaphoid fossa is named the pterygoid tubercle, and immediately above this is the posterior opening of the pterygoid canal. Projecting backward from near the middle of the posterior edge of medial pterygoid plate is an angular process, the processus tubarius, which supports the pharyngeal end of the auditory tube. Thank you.